Hi, everyone, and welcome to the next installment of the Rocky Mountain MIREC Short Takes on Suicide Prevention podcast. I'm your host, Adam Hoffberg, and we are reporting in from the Dissemination and Implementation Conference here in Washington, D.C., and we're really excited to be sitting down with Lindsay Martin. Dr. Martin works for iQuest Houston and with the VA Center over there, and she's going to introduce herself and tell us a little bit about herself.
Hi, thank you, Adam. It's a pleasure to be here this morning. So, as you said, I'm from the Center for Innovations in Quality, Effectiveness, and Safety in Houston. So we're one of the HSR&D coins. And I work a lot with Dr. Jan Lindsay from the South Central MIREC on her multi-site quality improvement project called Serving Veterans Where They Live. It's funded through the VA Office of Rural Health, Salt Lake City Resource Center. And we're doing a lot of really great work standing up a video telehealth to home program for the delivery of evidence-based mental health care.
Very cool. So I understand you're going to be presenting on this work at the conference. Can you tell us a little bit more about this project?
Sure, yeah. We have a presentation tomorrow morning, and it's part of a panel session that Dr. Aaron Finley from San Antonio VA and Dr. Allison Hamilton from the Greater Los Angeles VA have put together on the use of ethnography in implementation science. And so our work is highlighting how we're using the periodic reflections method to document the implementation process that Dr. Lindsay is using to stand up her telehealth programs for rural veterans. And so what we're trying to do is really identify what's working and what's not with our implementation strategy to be able to more widely disseminate telehealth programs so we can have more providers adopt telehealth to home and serve even more rural veterans in need.
Excellent. So important. Tell our listeners a little bit about what ethnography is and how that's going to help you advance our understanding of implementation science.
Ethnography is grounded a lot in anthropology, and so it's a way of really engaging with your research participants in in a long-term way. Now, in the context of implementation research, we have to adapt this method to be able to use it, since we don't have a lot of time to be able to have long-term relationships with our stakeholders, or we may only have an opportunity to do one particular interview with someone, or not be actually able to do participant observation, and we have to find other ways of collecting the information. And so it's a way to really get a holistic perspective of the implementation process by adapting the method. And so while I'm not able to join Dr. Lindsay on her site visits or on the implementation calls she has, by doing these periodic reflection interviews with her and Dr. Stephanie Day, her co-facilitator, I'm able to capture in as close to real time as possible the challenges of implementation and some of the barriers that they've faced, and what they do as an implementation team to resolve those barriers and really stand up these telehealth programs and adapt them to meet the needs of each site.
I see. So just to make sure I'm kind of following you, so they're going out to the sites and helping stand up these telehealth programs, and you're sort of interviewing the researchers.
I am, yeah.
Okay.
That's actually, it's a method where I sit down with them, and so I'm not able to actually accompany them on a site visit, or if they're doing something virtually, I'm not able to sit in on that call, but we're still able to capture all of that really good subjective information on implementation that we can't capture in any other way. And so an ethnographic approach is really able to give us that, what we call in anthropology, that emic or insider perspective, and by talking to facilitators and getting this information. So
if we step back for a minute, could we just talk a little bit about telehealth and why that's important, and especially in the VA system, why we're pushing so hard to implement and roll this out across the nation?
Yeah, certainly. Telehealth has really grown in the VA in the past several years. And so our initial projects were back in 2014, and they were clinical demonstration projects. And then as things were moving along in the VA system, in 2017, the VA, as part of its modernization initiative, started standing up the telehealth programs and implemented VA Video Connect technology, which was able to allow the veteran to connect with a mental health provider in real time. So it's synchronous delivery. They're able to talk to their mental health provider at home at work or some other secure location, and they're able to communicate with their provider in the comfort of their own setting. And this is especially valuable and a lifeline for rural veterans that may face a 2 to 4 hour commute to the closest VA or VA community-based outpatient clinic.
Yeah, such important work. I'm glad you touched on a few of those things. One is that it's secure and, HIPAA compliant and all those aspects of healthcare that one might worry about when they're discussing personal information.
Yeah, everything is within the VA system, so it's completely secure, and veterans love it. They tell us in our interviews they have really found it to be so helpful to keep them connected to their providers. And we're highlighting in our presentation tomorrow the story of one veteran, a female veteran in her 30s with a young child. She actually had to take her child with her to her VA appointments when she had to go in person and commute 2 hours one way by bus. But when she was placed on bed rest, she wasn't able to make her in-person VA appointments. So telehealth was really a lifeline for her. And initially, while she thought, it's not going to feel as personal as being there in person, physically in the clinic setting, she really loves it now. And so by trying the technology, using the iPad, she really feels connected to her provider. And so these are just some of the powerful stories that we're getting through some of the evaluation work that we're doing by interviewing veterans. And we're really, by doing these periodic reflection interviews with Dr. Lindsay and Dr. Day, capturing the implementation process, we're capturing veteran perspectives, and we're hoping to be able to increase provider adoption as we start to spread throughout the VA system and really show that telehealth works, veterans love it, and the providers that we work with have been so supportive.
Excellent. Yeah, that's really a powerful story, and I guess hearing about the providers' perspectives might decrease other providers' hesitance, or where do you hope to see this research kind of going next?
Yeah, that's a next step is we're hoping to interview providers and get their perspectives on telehealth. Dr. Lindsay right now she communicates regularly with her site champions to be able to work out any local issues that need to be worked out at the site level. And so her role as the external facilitator is to empower the site champions to stand it up within their own center and then slowly start to build telehealth and build provider adoption. And so starting small and then being able to work up to more and more providers adopting telehealth.
So thanks for sharing that, Lindsay. I actually was curious a little bit more about your center and the overall mission and the work that you do. It's called iQuest Houston.
Yes.
Tell us about your center.
Sure. I've been there for the past 6 years, and so I was lucky enough to come in as an HSR&D fellow at the center through the program there. And so it's a really diverse center that has a lot of focus on mental health, patient safety, patient-centered communication and medical decision-making. We have a really robust methodology and statistics core. And so it's really been a fabulous opportunity for me as an anthropologist to work in such a multidisciplinary environment. And so on any given day, I'm working with a cardiologist, a mental health clinician, all sorts of different professions, statisticians, and it's really a great opportunity. It's a large research center, and we're all located in one building, so it's easy to find one another, easy to collaborate. We don't feel siloed. We feel like we're able to knock on each other's doors and be able to have that cross communication. And the South Central MIREC is co-located with us, and so Dr. Lindsay and her team, many are investigators through the South Central MIREC, and so that brings another perspective to our center. We have such a strong mental health focus and focus on the needs of rural veterans, and we really just have a robust, very diverse research program. It's an exciting place to work.
Fantastic. Yeah, I'm really curious, and I look forward to connecting back in with you when this study gets a little further along to hear about the rollout of telehealth throughout the VA.
Yeah, we're excited. It's gaining steam, and our providers have been so supportive that are involved in this clinical demonstration project. And so, and our funders have been so generous with their time and mentoring us on, standing this up and hopefully someday going enterprise-wide. So.
Excellent. So before we wrap up today, can you just let us know how folks can reach you if they're curious about your work or want to connect with you or ask you questions?
Yeah, the best way would be through my Twitter handle. So it's at LA Martin, PhD. And so I'm just now getting into Twitter a little bit more, but I do regularly check and am tweeting a little bit. So that'd be a great place to check out some of the work and that we have going on.
Excellent. Well, Lindsay, thanks for taking time out of your busy schedule here at the D&I conference to tell us a little bit about your work, and best of luck to you. We look forward to connecting again in the future.
Thank you. It was really a pleasure to do this. Thank you so much.
Great. Well, folks, that's going to do it for our little window into the D&I conference here in D.C. And join us next time for more interviews on important work in veteran mental health, suicide prevention, and resilience.